Hello, Dr. Wood. This is my cumulative presentation for the final research proposal. And mine is, how do athlete-focused eating disorder screening tools compare to those for general population? Alright, for the introduction, as athletic trainers, our injuries are not our only focus. Athletes' overall health and well-being fall under our role and our care. Eating disorders are one of the most serious conditions, and they often get undetected. It's simple as like no one noticing or caring or thinking that what they're doing is normal, and their teammates might even be doing the same things and not even realize what they're doing is disordered eating or any habits like that. Female athletes often face unique pressures, and this can lead to detrimental outcomes. The pressures that they might face is just like the media and just added attention because they're females, just their uniforms alone, all that makes them stand out. Things as simple as group weigh-ins, uniforms, and coaches' words can lead to female athletes restricting food, using diuretics, or even adding an extra workout on top of their practice. Because they just might think it's fine once they're doing their lift for practice, and then they have practice, and then they might even just go for a run later or go back to the gym to get extra cardio in. And they think that might be helping, but they're really disordered habits that could lead to an eating disorder. This not only affects their performance, eating disorders can also lead to long-term physical and mental health problems. Female athletes are at a higher risk than non-athletes to developing eating disorders. But as athletic trainers, we need to recognize these problems early on. It is our responsibility to keep our athletes safe. How we can do that is by having an eating disorder screening tool on our pre-participation exams. And not all sports or just divisions require the pre-participation exam with the screening tool added on. For the screening tool, it is important that we are using one that is specifically made for athletes. This is because tools like SCOFF or E26 do not account for the workload that athletes go through daily. SCOFF and E26 are general population tools. General population tools might deem them as having an eating disorder just based on the amount of scheduled practice. So like, just because they're having lift and practice in the same day, let's say that equals like 3 hours or so, them answering these questions based on a general population tool might deem that as an eating disorder, but really it's just the workload that a collegiate athlete has to go through and their body's used to going through. And the general population tools don't account for that, so it might mislead them as diagnosing them with eating disorders, which could cause problems later down the road. This is why my CAT paper compares general population tools versus athletic-based tools to see which is more accurate for female athletes to use, and specifically to females, because they, just their bodies alone with their hormones and all of that, need extra care and attention, especially when it comes to exercise and proper nutrition, because just adding on the proper, them having the workload that requires them as being a collegiate athlete, but not having the proper nutrition with it, could have them lose their period and lead to problems. Okay, so for the research section, my purpose statement. The purpose of my CAT paper is to determine the effectiveness of athlete-based screening tools for eating disorders compared to the screening tools for the general population. With the unique factors female athletes face, it is important to account for them when having the athletes answer the screening tools that they are going to be best fit for their situation or sport. General population tools often leave out the workload that athletes face or leave out not asking specific questions for females. The goal or purpose of this cat paper is to guide athletic trainers to pick the most appropriate tool for their female athletes that fits the need of their sport the best. Because all sports are going to have different demands on them, especially for females. Like, I use gymnastics and dance for an example in my cat paper. So gymnastics, their uniforms alone with the leotards, they're pretty exposed, and especially with the events that they do and like let's say when they're doing floor routines or beams, like they're going to be exposed in some way. And especially with the uniform, it adds extra pressure on what they're looking at or what they look like. So that might lead them to do unhealthy habits because they know that people are going to be watching them and they know what they have to wear when they perform those like vaults or the beam or the floor routines, bars, all that. They know what they're wearing and they know what they're going to be exposed to. And for, let's say, a ballerina for dance, they already have to be particularly lean for their sport, and that might lead them to compete with other ballerinas, or they know they have to do a specific lift, and the male ballerina that they're with like can't lift them as well, or they think that they're going to struggle, so they are going to restrict themselves before the performance so they know that the lift is going to go well, and just stuff like that. Like they have a lot of unique factors, so it's important to have the right tool for your athlete and their needs. And for my research question is which screening tool most accurately detects eating disorders compared to general population screening tools? Since female athletes are at a higher risk, it is crucial to use the proper tools to get the proper help. These tools can help detect early warning signs and is also to detect whether eating disorder is prevalent or not. The proper tools that you need will ask questions like, how much additional exercise outside of practice do you partake in? Or do you find yourself restricting food before competition? These questions are needed because they relate to the athlete specifically and can show warning signs. General population tools might ask questions like, how much exercise do you partake in daily? And as an athlete, you're going to be having days where you might be working 3 or more hours a day in activity. When, like I said earlier, it's a 1 hour lift, 2 hour practice, or what have you, an hour and a half there, hour and a half in practice. But those general population tools might deem that as having an eating disorder just because of exercising 3 hours a day is not healthy. But as an athlete, you know it's specific to practice and lift. And that might not even be an everyday thing. So it's really important to have these tools that can detect early warning signs and early detections because they're asking the questions that pertain to the athlete specifically. Alright, for the method section and for my search strategy, I use databases like PubMed, EBSCOhost, Medline, Cochrane Library. I chose these ones because they had the most amount of articles for my topic. There were some databases that I used or tried to use that would only show up like 5 or 7 articles. Like it wasn't giving me much information on my topic. So these databases provided the most amount of information. Especially since it's all medical based, it was easy to find the proper amount of articles to sort through and see if they were relevant to my topic. My search terms or Boolean were athletes and eating disorders, or screening tools and eating disorders, and athletes, female athletes and eating disorders. I kind of just shuffled the words around to make sure I could find enough articles, because again, some of them, when I was searching up, only had a couple options pop up, or it was only about eating disorders or only about athletes. Like, it took a while to find the good combination of search terms for what I was looking for. My exclusion criteria was female athletes and eating disorder screening tools, and exclusion were male athletes and no mention of a screening tool. Female athletes and eating disorder screening tool were included because that's the whole purpose of my cat paper, was to use based on female athletes and the use of a screening tool, or just which screening tool that they used. And I excluded males or no mention of a screening tool because I'm looking at female athletes and I need a screening tool for my cat paper. There was one article that I had that did the same study on male and female athletes, and all the information, all the data was separate, so I did use that article just because even the results of the data were separate between male and female, so I was able to keep, there was no influence of the male on the female scores. And then for my quality assessment, I use tools like CRAP and Quadis. So CRAP is currency, relevance, authority, accuracy, and purpose, and Quadis is quality assessment of diagnostic accurate studies. And that one focused on the bias selection, withdrawals, representation, all that. So I chose CRAP and Quadis for the studies because of what each of them look at. I used CRAP to make sure the information on the article is relevant, like if the author was allowed or even certified to speak on the topic, and what was the purpose of the article, like if it was to sell me something or teach me about the topic. I used Quadis for the information in the study, like patient selection, any bias or any withdrawals. Since I'm doing a cat paper, I felt it was important to use both of these screening tools because it would lead me to a more of an appropriate article that would be beneficial for my topic. I wanted to make sure that I was getting both a quality article from the authors as well as the information within the study was credible. For my data extraction, I extracted data from what screening tool they use, what female population they use, the general population tools used, and the results of any eating disorders. So for the screening tool that they use, that one was for if they use anything like FAST or just any of the athlete-based screening tools. And then the female population, that's like if they were their sport type, an aesthetic sport versus endurance, or their age group, if they just had that, or if they mentioned collegiate, because some mentioned like 18 through 26, and some said collegiate, some said the sport that they were participating in, so just like the female population that they use in general. And then what general population tools they use, if they use E26 or SCOFF, stuff like that. I wanted to see what tool they use for the general population. And then any results of eating disorders or disordered eating. And then those results would come from general population or an athlete-based screening tool. I just wanted to know how many eating disorders they were diagnosing with these tools. And then for my synthesis plan, I broke each section down so it would allow me to answer my research question. I will group the studies by the use of athlete-based screening tools and general population-based screening tools. This is so I can gather information on each screening tool used. I will then compare the validity and reliability of the tools that were used. So regardless of what the tools, I want to see how valid or reliable they were. I'm also going to compare the different female populations. Again, that's based on aesthetic, sport, like dance or gymnastics, endurance, like running, track, soccer, anything like that, as well as their level of competition, college, professional, or just based on their age. It all depends based on the article. And then me comparing these findings will help lead to my answer of my research question. And then these findings will also help my purpose of guiding athletic trainers to use the best tool for their care of their athletes, to making sure they're getting the specific tool based on their athlete and what's best for them.